The U.S. Food and Drug Administration has just announced a significant and controversial shift in its COVID-19 vaccine policy, signaling a new phase in the nation's pandemic response. For years, the FDA's approach was to make vaccines widely available to as many people as possible, aiming for broad community protection. Now, the agency is tightening its guidelines and introducing stricter limits on who can receive the latest COVID-19 shots. Under these new rules, eligibility for the updated vaccines is being narrowed, with a focus on those who are most at risk of severe illness. This means that many healthy adults and younger people may no longer qualify for booster doses, even as new variants continue to circulate. This marks a clear departure from the previous inclusive strategy, creating what some experts are calling a two-tiered system. The new policy prioritizes the most vulnerable, such as the elderly, immunocompromised individuals, and those with underlying health conditions, while others are left to rely on previous doses or natural immunity. The updated vaccines are now reserved for these specific groups, leaving millions of Americans without access to the latest boosters. This has sparked debate among public health officials, with some arguing that it could leave gaps in community protection. This abrupt change shifts the focus from universal protection to a more targeted approach, aiming to shield those most likely to experience severe outcomes from COVID-19. The FDA says this strategy is based on evolving scientific evidence and the need to allocate resources efficiently. For millions of Americans, this means rethinking their personal risk and protection strategies. People who previously counted on regular boosters must now assess their own vulnerability and make decisions about masking, social distancing, and other precautions. The implications of this policy change extend far beyond individual choices. Schools, workplaces, and entire communities must now adapt their health protocols as they prepare for the upcoming respiratory virus season, balancing safety with the realities of limited vaccine access. Understanding the details of this new FDA ruling is crucial for making informed health decisions. Staying updated on eligibility, local guidelines, and alternative protection measures will be more important than ever. Ultimately, this decision reshapes our approach to COVID-19, emphasizing targeted protection for those at highest risk over the previous goal of widespread immunity. As the situation evolves, staying informed and proactive will be key to navigating this new chapter in the pandemic. The new FDA guidelines restrict COVID-19 vaccine eligibility to specific groups. Primarily, individuals aged 65 and older can receive the shot due to their higher risk of severe complications. People with underlying health conditions like chronic lung disease or diabetes are also eligible. Healthy children, teenagers, and adults without pre-existing conditions are excluded. This contrasts sharply with the previous policy of broad vaccine availability. Clinics and pharmacies must now turn away those previously encouraged to get vaccinated. The FDA's decision has sparked debate, drawing a clear line between high-risk and low-risk groups. The U.S. once pursued mass vaccination, but the strategy has shifted dramatically. Initially, vaccines were available to all, promoting community-wide immunity. Schools and businesses encouraged vaccination as a civic duty. Now the focus is on high-risk individuals, treating vaccines as targeted therapeutics. This shift marks a significant change in the nation's COVID-19 response. The previous framework of broad eligibility has been dismantled. The new policy limits vaccine access, signaling a more restricted role for vaccination. This change reflects a move from population-based prevention to high-risk mitigation. The recent policy shift regarding vaccine recommendations is largely justified by what officials describe as a high level of population immunity. Over the past few years, millions have either been vaccinated or have recovered from infection, leading to a significant buildup of immunity across the country. This widespread immunity, according to health authorities, has changed the risk landscape and prompted a reevaluation of ongoing vaccine needs. Officials argue that for most healthy individuals, the existing immunity is robust enough to protect against severe illness, making additional booster doses unnecessary for the general population at this time. They point to declining hospitalization rates and milder cases as evidence that the threat has diminished for many. HHS Secretary Kennedy has emphasized that the new framework is rooted in the latest scientific data and a commitment to public safety. He insists that the decision was not made lightly, but after careful consideration of both the benefits and potential risks associated with repeated vaccinations. Growing skepticism about the necessity and safety of repeated mRNA vaccinations for low-risk groups played a significant role in shaping the new policy. Some advisors expressed concerns about possible side effects and diminishing returns from additional doses, especially for those not at high risk. However, this approach stands in contrast to the consensus among mainstream public health experts, who continue to find that vaccines are both safe and effective for most people. Many experts worry that reducing vaccine recommendations could leave some vulnerable populations at risk. Secretary Kennedy's actions mark a notable shift in U.S. health policy, signaling a move away from the more cautious strategies of previous years. The new policy is seen by some as a bold step, while others view it as a gamble with public health. The decision appears to be influenced not only by scientific data, but also by political ideology and a new interpretation of what constitutes acceptable risk. This has sparked intense debate among policymakers, scientists, and the public. While the administration claims the goal is to target resources more efficiently and focus on those most in need, many experts see the move as a departure from evidence-based practice and worry about the long-term consequences. Ultimately, the new policy prioritizes a particular viewpoint over established recommendations, raising questions about the future direction of public health in the United States. Across the country, the medical community has responded to the FDA's new restrictions with a wave of concern and disappointment. Leading doctors, infectious disease specialists, and public health officials have voiced their strong opposition, emphasizing that the decision could have far-reaching consequences for the nation's health. Many experts are calling the move short-sighted, warning that it undermines months of progress in the fight against COVID-19. Experts warn that limiting access to vaccines and treatments could significantly increase the risk of severe COVID-19 outbreaks, especially as new variants continue to emerge. They stress that the decision may leave vulnerable populations, such as the elderly and immunocompromised, at even greater risk. Dr. Tina Tan, a respected pediatric infectious disease specialist, highlights the danger of allowing the virus to circulate more freely. She points out that relaxing restrictions now could lead to more hospitalizations and deaths, particularly among those who are not yet fully protected. Pediatricians are especially alarmed by the implications for children and pregnant women. They argue that these groups are already at higher risk, and that limiting their access to updated vaccines could have devastating effects, potentially reversing the progress made in protecting these vulnerable populations. Renowned experts like Michael Osterholm and Dr. Paul Offit have spoken out, expressing deep concerns about the reduced availability of vaccines. They warn that this policy could set a dangerous precedent, making it harder for people to get the protection they need and undermining public confidence in the vaccination process. Many in the medical field fear that the new policy could erode public trust and dismantle the infrastructure that has been built to deliver vaccines efficiently. Closing vaccination sites and reducing outreach efforts, they say, could make it much more difficult to respond quickly to future surges or new variants. The scientific consensus remains clear. Updated vaccines offer valuable protection against severe illness, hospitalization, and death. Researchers and clinicians agree that making these vaccines widely available is essential to keeping the pandemic under control and preventing unnecessary suffering. Many doctors see the decision to restrict access as a political move that ignores the overwhelming scientific data supporting vaccination. They argue that public health decisions should be guided by evidence, not by political or ideological considerations. Ultimately, experts argue that this policy risks the health and safety of millions, prioritizing an ideological agenda over the well-being of the public. The medical community continues to urge policymakers to reconsider, emphasizing that science, not politics, should lead the way in protecting our communities. Despite restrictions, eligible individuals still have vaccine options. Updated mRNA vaccines from Moderna and Pfizer-BioNTech are approved. These vaccines target recent strains, offering better protection. Eligibility varies slightly by age, crucial for parents and pediatricians. The Novavax vaccine provides a non-mRNA option for those 12 and older. Multiple vaccine types ensure choices for eligible individuals. Previous emergency use authorizations for older vaccines are revoked. The focus is on newly approved formulations for high-risk groups. The sudden policy change has created confusion and anxiety. Americans are bewildered by the shift from widespread vaccination to targeted protection. Parents of healthy children feel anxious and powerless. Healthy adults worry about bringing the virus home to vulnerable family members. Conflicting messages from government and health experts compound confusion. The division leaves people struggling to make informed health decisions. Misinformation fills the vacuum left by a unified public health message. The public must navigate this new landscape with caution and informed choices. Experts warn of risks from the new policy, especially for those ineligible for vaccination. Long COVID remains a threat, with symptoms affecting anyone. Allowing the virus to spread unchecked risks new variants emerging. A new variant could evade existing immunity, causing severe disease. Increased cases could strain the healthcare system. A broad vaccination strategy creates a collective shield. Narrowing focus leaves holes in that shield, increasing community risk. Experts see this policy as a gamble with public health. Stay informed and proactive in protecting your health. Understand the new rules and what they mean for you. Updated vaccines are restricted to high-risk groups. Consult your doctor to understand your risk profile. Doctors can advise on other protective measures if you're ineligible. Rely on credible sources for information, avoiding misinformation. Basic preventive measures like hand washing remain effective. Stay informed and practice healthy habits to navigate this new chapter.